Every basic surgical tool explained. Category 1 is cutting and dissecting. These open the body. The scalpel. A short, sharp blade on a metal handle that makes the first incision. Blades are numbered. The number 10 is standard for large incisions. The number 15 is for finer, more delicate cuts. The blade is detachable and swapped between procedures. Mayo scissors, heavy duty. Cuts thick tissue and sutures. Metzenbaum scissors, long and fine. Used for delicate soft tissue dissection. Operating scissors, general purpose cutting. Available straight or curved. Curved versions reach deeper areas. The Bovie uses electrical current to cut tissue and seal blood vessels at the same time. Cuts and cauterizes in one motion, reducing bleeding while opening. Used in virtually every open surgery. The Rongeur, plier-like, with sharp cup-shaped tips that bite away bone fragments. Used in orthopedic and neurosurgery. Osteotomes and chisels split bone cleanly. Bone saws, manual or powered, cut through larger bone sections in joint replacements. Category 2, grasping and holding. Once the body is open, surgeons need to hold tissue and maintain control. Adson forceps, fine teeth, used for gripping skin during wound closure. DeBakey forceps, atraumatic, grips without crushing, used on blood vessels. Alice forceps, interlocking teeth for firm grip on tough tissue like fascia. Babcock forceps, smooth rounded jaw, holds delicate tubular structures like the bowel without damage. Langenbeck retractor. L-shaped hook, one of the most common, requires an assistant to hold. Diva retractor, curved, holds back organs in abdominal surgery. Army-Navy retractor, double-ended, used near the surface for shallow retraction. Self-retaining retractors lock in place, no assistant needed. Balfour retractor spreads and holds the abdominal incision open. White Lana retractor is used for smaller, shallower incisions. Both free up the surgical team for other tasks. Category 3. Hemostatic instruments. One purpose, stop the bleeding. Mosquito hemostat. Small clamps tiny surface vessels. Kelly hemostat. Larger, handles bigger vessels and deeper tissue. Coca clamp. Toothed aggressive grip for tougher structures. All hemostats have a ratchet mechanism that locks them closed automatically. Backhouse towel clamp. Sharp-tipped, secures sterile drapes around the surgical field. Doyen intestinal clamp. Temporarily occludes sections of bowel without crushing. Bulldog clamp. Used on small blood vessels to stop flow during vascular repair. Category 4. Retracting and exposing. These tools keep the surgical field visible throughout the procedure. Wound retractor, ring-shaped, holds the wound open 360 degrees in abdominal surgery. Morris retractor, flat paddle, sweeps organs aside. St. Mark's retractor, angled for pelvic surgery, gives access to the rectum and surrounding structures. Malleable retractor can be bent by hand to any shape needed. Sen retractor, double-ended, one side, is a prong rake, the other a flat blade. Common in hand, foot, and plastic surgery. Alm retractor, small self-retaining version for tiny incisions. Skin hooks, fine sharp hooks that lift skin edges gently during plastic and reconstructive procedures. Category 5. Suturing and closure. The wound gets closed layer by layer, from deep tissue to skin. Mayo Hagar needle holder. The standard. Flat-grooved jaw. Grips the curved suture needle and drives it through tissue. Castroviejo needle holder. Much finer, used in eye and microsurgery. Webster needle holder. Smaller version for plastic and hand surgery. The ratchet locks the needle in place while the surgeon ties the knot. Absorbable sutures, Vicryl chromic gut, dissolve over days to weeks, used inside the body. Non-absorbable sutures, nylon proline, permanent, used on skin or in areas needing lasting strength like the heart. Sizing, the higher the number, the thinner the thread. A 6-0 suture is finer than a 2-0, skin stapler. Fires metal staples across surface wounds. Faster and more uniform than hand suturing. Linear stapler, used inside the body to simultaneously cut and seal bowel or stomach sections. Circular stapler, creates a ring-shaped join inside tubular structures like the colon. Endoscopic stapler, long and thin version, used in laparoscopic procedures. Category 6. Suctioning and aspirating. The field fills with blood constantly. These keep the view clear. Yankauer, rigid, standard suction for most open procedures. Connects to wall suction via tubing. Frazier, small and narrow, used in tight spaces. Ear, nasal cavity, spine. Pool has a perforated shield that prevents bowel from being accidentally suctioned. Used specifically in abdominal surgery. Bulb syringe. Basic saline irrigation. Flushes blood and debris from the field. Toomey syringe. Larger volume irrigation via catheter. After surgery, drains are placed inside the body. Jackson-Pratt drain. Soft bulb collector that applies gentle suction. Blake drain. Flat channel drain for larger fluid volumes. Both continue removing fluid during recovery. Trocar hollow tube inserted through small incisions in laparoscopic surgery. Camera and instruments pass through it. Laparoscopic grasper. Long, thin version of a forceps for keyhole surgery. Laparoscopic dissector. Separates tissue through tiny incisions. Speculum. Opens a body cavity and holds it open for inspection. Used in gynecology and ENT nerve hook. Gently moves nerves aside without damage. Critical in spinal surgery. Curette. Small spoon-shaped tool that scrapes tissue. Used in ear, uterine, and dental procedures. Bone drill and reamer. Prepares bone for implants in orthopedic surgery.